Medical Minute. I'm Dr. Abiola Ajayi, the MD CEO of ROA Specialist Hospital. You can see us on ROA Specialist Hospital at Facebook, Instagram, Twitter, X, and YouTube. So, would you like to last longer in bed? I know most people would. And when you can't last long enough in bed, that's called premature ejaculation. 30% of men will suffer from premature ejaculation in their lifetime, but only 9% of men will actually see their doctor about it. When you define premature ejaculation, it typically means from the time the penis enters the vagina, 1 to 2 minutes before you ejaculate, or you are unable to control or delay ejaculation during any type of sexual encounter, or that it causes you concern, depression, and or anxiety when you're not able to last as long as you'd like to. And it's best to clarify the definition to state that it's based on both you and your partner. So if your partner is happy and you're happy, then there is nothing like premature ejaculation. But if you're not able to satisfy your partner, or you yourself don't feel satisfied or feel disheartened or disgruntled about it, then there's need for the discussion and need to look into it. Average length of sex for all couples is 5.7 minutes. Surprisingly short. But if you do a survey asking men and women how long they would want to have penetrative sex, the numbers come back between 7 and 13 minutes. So almost double to what the average length of time is. And there's some reasons why. When you look at premature ejaculation, the cause in the body has something to do with your serotonin, which is a hormone that regulates not only mood, but sleep and happiness, as well as the serotonin receptor. There are two types of premature ejaculation. Primary premature ejaculation, where you've had it all your life, you've always had this very, very short period. And secondary or acquired premature ejaculation, where things were fine and they've slowly gotten worse over time. Ejaculation is controlled by your spinal ejaculatory center, which is in your spinal cord, and ejaculation is a reflex in response to friction. So just like sneezing can be a reflex in response to something entering your nose or you seeing a bright light, ejaculation is also a reflex, and it's modulated by that hormone I mentioned before, serotonin. Other things can affect premature ejaculation, which is your mental state, depression, anxiety, even guilt, and as well as medications you're on and your overall medical status. You come to the doctor, or a doctor like me, I'm not going to, if your main complaint is premature ejaculation, I'll ask you some basic health questions and questions about your erections and so forth. I want it to be very clear that premature ejaculation and erectile dysfunction are two different issues. And we'll talk a little bit about erectile dysfunction at the end. But premature ejaculation is based on the length of sex between you and your partner. So let's talk about some things that you can do for premature ejaculation. One of the treatments that is shown to increase your time to ejaculate by at least a factor of 8 is psychotherapy or sex therapy. And it revolves around some of those concepts we talked about before, which is anxiety, depression, even guilt. If you're able to treat this with psychotherapy or sex therapy and treat your depression, anxiety, and or guilt, you can oftentimes improve by a factor of 8. Another treatment modality that works very well is the start-stop method. And the start-stop method is during sex, before you climax, your partner will hold the shaft of your penis very hard until your erection at least partially goes down. You're going to do that 3 separate times during your lovemaking, and you try to do that 3 times a week. Over time, 4 to 6 to 12 weeks, you'll see a improvement. And the studies have shown that improvement has been also by almost a factor of 8. One of the other things you can do at home, which are called pelvic floor strengthening exercises. And this can be taught either in the office or you can learn through videos. After those psychotherapy, your start and stop method, and your exercises, then we now talk about medications and other things we can use. One of the most common things used for premature ejaculation nowadays is a spray that reduces sensitivity, and that spray is sprayed on the head of the penis, allow it to set for a few minutes, and it's been shown to increase dramatically. You have so many different types of sprays, but they all revolve around some form of lidocaine or some form of a cane in there. Then we have many different medications that can help. I want to stress that the medications for erectile dysfunction are not the same medications necessarily for premature ejaculation. They're oftentimes very different. Although people on medication for erectile dysfunction have reported that some of them see longer times to ejaculate. I will not get into specific names because here in Nigeria, people can buy things over the counter, almost all drugs over the counter, and I wouldn't feel comfortable about naming drugs and having people take them without a medical intervention. But there are many medications that I use them with my patients every day, and I rarely have a patient that can tolerate the side effects, which are usually nausea, sometimes headache, or diarrhea, and it's very rare. Less than 5% of patients that I treat have those side effects. If you can tolerate those, majority of patients see a significant increase with the daily medication use. So you use the medication daily, usually one to two capsules a day, and it takes about 5 to 10 days to get the initial effect, and then you can still get peak effects up to 3 weeks out. Some other medications, which I won't name, but we have access to, you take before sex, 2 to 6 hours before sex, and they work on that serotonin receptor, and they reduce the time to ejaculate. In the literature, all of those medications work very well. I typically use the daily medications because they're more spontaneous. You don't have to remember to take it before sex, and it's always working in your system. But at times when people cannot tolerate those medications, we use the previous ones. Next, I'll talk about erectile dysfunction. If you have any more questions about premature ejaculation, please visit our socials and send messages, or reach out directly on our website, theroahospital.com, or you can call me. My number's everywhere on socials and on our website. So let's talk briefly about erectile dysfunction. We've covered it before. I'm going to cover it again because it's such a important topic. But erectile dysfunction is the inability to achieve an erection that is suitable for vaginal penetration. Premature ejaculation assumes you already have an erection, but you just don't last long before you ejaculate. So with erectile dysfunction, first question I'm going to ask most patients that complain about it, I'll look at their age. Do they have high blood pressure? Do they have diabetes? And one of the reasons why is because your erections are all really blood flow into the penis, and the blood flows through very, very small blood vessels. So we call those microvascular complications of either high blood pressure, hypertension, or diabetes. Usually they affect small blood vessels, especially those that help you achieve erection. If you're able to stabilize your blood pressure and stabilize your blood sugar, oftentimes we can improve significantly. But people that have high blood pressure and diabetes, or people that don't, as you age, you may see more of erectile dysfunction, either because of decreases in testosterone, which is the male hormone that helps erections and libido, or the interest in sex, or other age-related factors as more medications, more chronic diseases, and so forth. It's important to know that there is no age. I have a lot of men that are 70 and 60, late 60s, and even in the 80s that say, "Oh, doc, I'm too old for sex." There's no age. As long as your heart is in good shape and you're in enough physical shape, there's no age where you're too old for sex. So if your erections are not suitable or satisfactory, please come and see the doctor, and we can help you with that. We're going to look at your medical history, like I mentioned before, and we have so many different options, from psychotherapy techniques to tablets that you take either daily or before sex. We have penis pumps, we have injections. We have so many different options available to us that there's no reason to suffer in silence. That's all for this Medical Minute. I'll see you next week.